This section will use some clinical as well as laboratory data to show that calipered kinematic alignment total knee arthroplasty restores the native laxities. And if the native laxity is restored, then it's hard for the knee to be too tight or too loose. And therefore this reduces the risks of stiffness and loss of motion. We can get a little idea of how the normal knee behaves by a paper that we published in 2015 and 18, where we looked at the native knee laxities at 0 and 90 degrees of flexion and the relationship to the goal of gap balancing in total knee arthroplasty. And the important things to glean is that the extension space is tight and rectangular and does not vary between subjects, and the flexion space is looser, trapezoidal, and varies between subjects. So let's look at the varus valgus laxity with the value on the y-axis. The x-axis shows flexion angle. We're only going to focus at 0 and 90 degrees. And what you'll see at 0 degrees, there's hardly any varus or valgus laxity in the native knee. And the second thing to take away is the error bars are very small. That means there's hardly any difference between people in this world. Normal knees, full extension, the knee is a rigid body, negligible VV laxity. We're going to use that to help set the varus valgus cut of the tibia to restore the native alignment. At 90 degrees, it's a different story. At 90 degrees, the lateral laxity is greater than the medial laxity, 3 to 1. There's fairly large error bars of at least plus or minus a degree, which means there's variability between patients, and we want to preserve that variability in our knee replacement. And that the flexion gap now is looser than extension and trapezoidal in shape. And so we want to use this to help us judge whether or not the tibial resection is proper in terms of varus valgus at 90 degrees, because if it's tighter medial at 90 degrees of flexion and lateral, then a spacer block ought to pivot medially. And we'll show you these in a moment. So the extension space is rectangular and the flexion space is trapezoidal. So schematically, this is what it looks like. The medial lateral gaps are the same in extension. In flexion, the medial gap's looser than in extension, but it's also narrower than the lateral gap, which gives you the trapezoidal shape. And you know this in the flexion space because you can't take a medial meniscus out in full extension. You can't open the joint. You go 30 degrees, 15 degrees, you can get in the medial compartment. Do the lateral meniscectomy, the lateral side opens more than medial. And so you want to maintain this normal relationship. You don't want to shut the lateral side down as the gap balancers do because it over-constrains the knee. Now, how do we use this information? Well, once we've made our cuts, before we put our trial implants in, we're going to place the knee in 90 degrees of flexion. We'll insert this thickest spacer block that fits and verify that the point of pivot is medial, which indicates a trapezoidal space and gives you an idea that probably the varus valgus cut of the tibia is reasonable. So there's our schematic, medial gap thinner than the lateral gap. Here's our spacer block. We have measured our distal and posterior resections on the femur and adjust them to match the thickness of the femoral condyles of the component, and you can see the pivot medial. If there's no pivot, then place a thicker insert in. If you have the thickest insert in and it's not pivoting or it's pivoting laterally, then it means you need to do more of a valgus cut on the proximal tibia. But before you make that step, place the knee in full extension, insert the spacer block, and verify there's negligible VV laxity indicating a rectangular space. So what we should see is very little movement between the distal femoral resection in the spacer block and the proximal tibial resection in the spacer block. If the lateral side opens, you need more of a varus cut. If the medial side opens, then you need more of a valgus cut. And that's how you fine-tune the varus valgus resection plane to restore the native limb alignment, with the assumption that the distal cuts are made to compensate for the amount of hardware or the thickness of the femoral condyles of the component. So if what you take off matches what you put back on the femur, then when this gap is negligible in full extension, this rectangular space, then you've restored the native alignment. Now, how about internal-external rotation? We can use that to help us indirectly set the tension, if you will, or the laxity is a better term in the flexion space. So the mean internal external rotational laxities of the native knee at 90 degrees are 15 degrees, plus or minus 15 degrees or so, and looser than extension. So let's look at the x-axis, flexion 0 and 90, y-axis, internal external rotation. And at 0 degrees, only 3 to 4 degrees of movement, small error bars. It's still a relatively tight knee and extension, a rigid body. At 90 degrees, though, much different. 15 degrees of IE with some variability between patients. So we'd like to preserve that, if we will. We don't want a knee that doesn't internally and externally rotate at 90 degrees. So we're going to verify this rotation, that it restores the native laxity, and you can get an idea maybe what that knee might be able to do by an examination at the start of the procedure of how much passive IE. Now, it certainly can be more than what you can measure or visualize at the start of the procedure with severely arthritic knees with large osteophytes and so forth, but you get a little feel for it. And then at 90 degrees with compression, it ought to pivot medially, and you ought to get about 15 degrees of IE. That gives you some confidence that the flexion space laxity is better. And how do we judge this is based generally on the slope of the tibial resection, and we'll discuss this a little later, but if the IE is too little, then the slope generally is too little or your insert's too big. But you know the insert is correct because in extension it works, so in flexion it's got to be a slope issue.